Good morning. I will start with the update on hospitals and case numbers, then I'll run through some extra support that we're providing local businesses who are doing it tough, especially hospitality. There are currently 148 people with COVID receiving care in Territory hospitals. This represents about 2.1% of our active cases. There are 16 patients currently requiring oxygen in our hospitals, one up from yesterday. We have 6 patients receiving care in ICU, same as yesterday, 3 in Darwin and 3 in Alice Springs. While we may have reached or be about to reach a peak in cases, it is reasonable to expect that ICU cases will rise over the next few days, as there is generally a lag. For this reason, in line with other jurisdictions, we are pausing elective surgery and day surgery in our hospitals to help our clinicians manage the current COVID cases and prepare for a potential increase in the next few weeks. This recognises the pressure on our frontline health staff, especially in our hospitals, and the extraordinary work they have done, are doing and will do. To the new cases. There were 1,004 new cases of COVID-19 in the Northern Territory in the 24 hours to 8 p.m. last night. Yesterday's case numbers have been revised up by 302 to 1,279. Active cases in the Northern Territory now stand at 7,094. On Sunday, I talked about what we need to be focused on with this Omicron wave, and that's providing the best possible care for a small portion of people who will get very sick from COVID. We have 7,094 active cases of COVID in the Territory. At least those are the ones that we know about. There are no doubt more than that, but some people will be so well with Omicron they just won't know that they have it. Of the 7,094 current cases, 6,946 of them are managing their COVID with a couple of Panadol, plenty of fluids, plenty of rest, and plenty of Netflix. They are well, they don't need any extra care. It doesn't mean it won't suck. COVID can still knock you for 6. It's not just a runny nose. But for the overwhelming majority of vaccinated people, you won't need acute care. Of the 7,094 cases, 148 are sick enough right now to need care in our hospitals. And of the 7,094 cases, just 6 are really sick at the moment, receiving acute care in an ICU. Those are the people that we are seriously worried about. I haven't run through those numbers again to diminish or downplay the challenge we are going through right now. I want to put it into perspective for Territorians, because there are people, some with very loud voices, who would like you to think that every case of COVID is a catastrophe and everybody should be taken out of their home and put into a hospital. Their heart is in the right place, but a response like that will be the medical equivalent of panic buying. Doing that will be treating a 2022 challenge like we are in 2021 or 2020. Doing that will be a Delta response to an Omicron outbreak. Doing that would not be wise. Kind, compassionate, but not wise. We did everything we could to keep COVID out while Territorians got vaccinated so that our systems could manage it. We never tried to deny it, we just tried to delay it. We now have widespread transmission of Omicron through the Territory, just as we expected, and we are managing it just as we prepared for. If we were to treat every positive COVID case as acute, then the people who actually are seriously ill, either from COVID or from other causes, would not get the care that they need. And our health staff, who are under strain, would be flattened. I have no doubt there'll be more and more calls in the coming days as we approach the peak of cases or come down the other side to test more, to evacuate more, to hospitalise more, to panic more. Here's why we don't overreact to every case. Testing every single person in a community, no matter if they are sick or not, takes up tests that we can use on symptomatic people later, the people who really need them. Flying a healthy person out of a community takes up a plane that may be needed to evacuate a seriously sick person from another community, a person who really needs it. And that's not necessarily about COVID. Putting a healthy person in a hospital bed takes up a hospital bed for a seriously sick person, a person who really needs it. And again, that's not just about COVID. We are making rapid tests available for free to Territorians who need to be tested. We are helping healthy people manage their COVID at home. We are keeping effective measures in place, like mask wearing and checking in, to help control the numbers. And we are tailoring specific and targeted responses to outbreaks in individual communities. So when someone really does get sick, we have the resources ready to help save their life. We are going to keep calm and carry on managing COVID in a common sense way. Now, to the extra support for territory businesses. The Delta outbreaks last year hurt businesses because they caused lockdowns and border restrictions. The Omicron outbreak is different. Businesses are open, and not every business has been affected the same way, but plenty are still hurting. Just like every part of the country, we're seeing a temporary dip in confidence as we learn to live with and manage COVID in our community. Now, I know our hospitality sector, our pubs and restaurants and cafes, are feeling it more than most. It's not going to last long, I am confident of that. We're going to get through this Omicron wave and come back even stronger than before. But while businesses and workers are hurting, we need to be helping. So today we are reopening the Territory's hardship register that worked so effectively in the early stages of COVID to help reduce costs for businesses that have experienced substantial downturns. Eligible Territory businesses who have experienced a 40% reduction in turnover will, for the first 3 months of this year, have their payroll tax waived, be eligible for a one-off grant of $3,000 for employing businesses or $1,000 for sole traders, and have their regulated utility bills reduced by 30%. This does not cover every single cost. It doesn't solve every single issue. It's not meant to. It's a bit of help right now to get people through this. At the end of the day, what these businesses need is people. And I'm confident that with each day, as we keep managing COVID in the community and get people more comfortable with safely moving about, the customers will be back, the tills will be ringing, and places will be safely packed again. And we will head into another high season as Australia's comeback capital. Thank you.
Thank you, Chief Minister. So the first thing is, this is what we've been preparing for 2 years. And it would look like that we are at or approaching our peak number of cases. And it is all about the numbers. And the thing that gives me confidence in terms of what we need is our ICU capacity, capability across the Territory, and also oxygen therapy and hospitalisation of those people who know need it. So I'd like to acknowledge the work that's been done over a long time for our frontline health staff. And I'm not just talking about the current pandemic, but often our health staff are working very hard all of the time, and we're going to make some adjustments over the coming days and several weeks to prepare for this short period of time where we might see a rise in cases that lead to a rise in hospitalisations. And that may be in a week or so's time. So this is a disease that in the main most people are going to be, I'll say it, mildly unwell, maybe not symptomatic at all. The main thing is that we need to approach this in a sensible way. And when I say sensible, that means the testing needs to be based on risk and symptoms. We also need to approach this in a way that the people who can stay at home do stay at home, who are positive. And we've been partnering with different health services around the country. I sent a letter to them yesterday thanking them for their participation, and the way we will go forward over the next couple of weeks is to ensure that there is a bed for people who need it. And I'm not just talking about COVID positive patients, we're talking about trauma patients and people who have cardiac presentations. Now, I have confidence that we have prepared for this time well, and now we need to make some adjustments in terms of elective surgery. Other jurisdictions have done this. We're partnering with other hospitals to assist us, to assist in the load. But most importantly, the people who are not unwell should not be coming out of their communities, and it's about partnership with communities where people can isolate. Now, when it comes to transmission of Omicron, it is so contagious that what we're seeing is it's in households well and truly. And in fact, that one could say that if you're in a household where you're positive, it is likely that the others are or will very quickly become positive. What we need is a system that allows us to identify people who are unwell, the people who need to be travelled to the hospital. We've got road transport issues, we'll have aeromedical retrieval issues if a whole lot of people are brought in that don't need that level of care. We've got strong partnerships and collaboration, which, you know, there's been multiple meetings over the last couple of weeks and late into the evening yesterday, how we all partner together, including GP partners that are assisting with COVID at home and also COVID of concern, where people need more closely monitoring each day. But in the main, most people are not going to be seriously unwell. And again, what gives me confidence right now and what we've prepared for is the numbers of people that are on oxygen therapy and in ICU, which have remarkably remained stable. It's not over yet. Most importantly, those people who haven't started their vaccine journey, then please do it, because these are the people that will suffer most harm. If you have not had your booster, go and get your booster. If you're eligible, go and get your booster. That's going to be the thing that protects us from serious harm and potentially death. We can do this as a community. We've partnered together with the community, including health services around the territory, and now we finally need to come together over this short period of time, and we'll then see a decrease in number of cases, I predict, and therefore a decrease in the number of new people needing hospital care. Thank you.
Good morning all. The system's working very well in the Northern Territory, and as the Chief Health Officer's just spoken about, the number of people who are in hospital should give you strong comfort that those who need to be in hospital are. They're receiving the appropriate treatment and they're being well looked after, and that's occurring across the whole of the Northern Territory. The simple message is we're not doing what we did in 2021 in 2022. The game has changed and we've adopted our posture accordingly. Many people are able to get through Omicron without being critically unwell. In fact, many are asymptomatic. So we don't need them being a burden on our system. Our key focus here is ensuring that those who are critically unwell, symptomatic, are tested, supported, and the appropriate response is provided to them. But the case remains. We deal with an incredibly unique operating environment in some of the very most remote parts of this country. The reason we have an emergency management structure in place is to ensure that the right people and the right services are being provided. Every officer in charge of a remote police station is a local controller under our emergency management plans. If you reside in a remote community and you have an issue, you would be a stakeholder within that regional emergency response. Raise your concern with the local controller. They will exhaust all available local options to resolve that problem. If it is beyond their means, they will then elevate that into the regional controller and ultimately into the Emergency Operations Centre. And that methodology has worked very well for us. Unfortunately, what is distracting from our business is that many people are going to other outside mechanisms as opposed to the internal emergency management structure. And then we are receiving a multitude of queries that we continually prove to be false. They're inaccurate. However, many of them cause alarm in the community. If people follow basic principles, then we will ensure that everybody gets what they need. Unfortunately, in Santa Teresa, a delivery vehicle went against advice to that community and got bogged with goods in store, and a community response had to be coordinated to be able to convey the rest of them while the truck stayed in situ. The broader issue is that truck has now caused significant damage to the road to Santa Teresa. So it's now a broader emergency response role that we've got to undertake with significant damage to a road that's relied on by a community. And for the sake of waiting a further 12 hours, which was what the weather advice indicated that the road would likely be passable by that point in time, the decision was made to go ahead. It's just one example that I want to raise where if you act outside of the realms of the advice we provide to you, then you create further issues and strain on our resources. So please, work with us. Be very reassured our critical goods group works continually with every store. The supply chain coming in, we have not declared an emergency because no emergency exists. We have had some disruption to the supply chain and it's been re-established. One of the broader issues we're contending with now, sadly, and it's not panic buying, it's selfish buying. People are going in when the stores have been replenished and buying far more than they need for a level of concern that is not commensurate to the reality. The supplies have improved, the volume has increased and continues to increase, and people are able to get access to the basic foods they need and now even some of the commodities that they enjoy. So again, as a community, as businesses, all come together and help us to help you. It's a simple message. Those local controllers are also working hard to make sure that people who are under stay-at-home orders who are COVID positive are staying home. Similarly, if you have any concerns that a person who is COVID positive is not doing that, let the police know and we will go and visit those people. You'll also be aware that the biosecurity zones have now been put in place. We will continue to support those, but I hasten to add again, we are not coming enforcement heavy in this approach. It is clear that the land councils and Aboriginal people wanted these zones put in place, and we're expecting the community will comply with those, understanding the fact that we want to keep people within their own bubbles and mitigate the likelihood of exposure in the major centres where the transfer of COVID is far more prominent. Again, we will continue the messaging to ensure that people understand what's in place. It's a simple message. Continue to work with us to help you. Thank you.
Chief Minister, hospital elective surgery wait times are already, I guess, stayed utter disarray before this decision was taken to delay them. I guess a lot of people now are going to have to be waiting a lot longer for their procedures.
So I believe, I can pass Dr. Heggie, it's about a 2 or 3 week delay we're proposing on the back of this. In many ways precautionary, but we do expect there to be a lag in ICU. It may not happen. We've got antivirals that have just arrived in the country and will be distributed. That will be available at on the front line for use, and so we may actually see a decrease in cases coming forward to hospital then into ICU, so that may allow for that as well. But I think this is a recognition of the work rate currently in our hospitals. So there'll still be, we believe, these beds being used. It's just being used for COVID. So it's just, I believe, a sensible precaution to take. It may not be needed, so but I'd rather pause elective surgery for 2 to 3 weeks and have that be a not needed decision than not pause it and regret it. But I can have Dr. Heggie add to that.
Yes, this is a really important question. This is for a short period of time. And I'd ask people who had planned surgery to understand that, and this will potentially also include day surgery. And we're doing it for a short period of time to allow bed capacity to be there if needed. This is not the long haul. The antivirals are in Australia. We're in the process of negotiating with the Commonwealth to have those here and to pre-position them in our remote communities and also in our hospitals, pharmacies. That's really important because they make a difference when it comes to that early part of the disease, as does oral steroids. But let's all work together on this. for a short period of time because it may not be required for very long at all.
Chief Minister, obviously sending a very clear and strong message today about the Territory's approach and the level of support and resourcing remote communities can expect. Just to be clear, for example, in say Imampa, where the local community store manager says rats were dropped off, people tested positive, they only have a nurse visiting once a week, is your message that that's the level of support that they're getting and they're left for themselves?
So response will get tailored on the community, on the health commander's advice. So there may be change postures within each different community. So it's not a generic, this is the approach. What I can say is this: we've had too many people try and push mild COVID into acute care settings, and we don't want to see that. So that's what we're trying to avoid. That does rely on someone locally on the ground making a decision. Now in Central Australia, through their local resourcing, they'll make decisions about whether Imampa needs more resources out on the ground, RRTs, other things. We can discuss that. But perhaps more importantly, if you have more than mild COVID, there are a range of things. That's always been the case in Imampa, pre-COVID, during COVID and post-COVID, that we can trigger RFDS or other measures that are needed to make sure that someone with severe COVID gets the treatment that they need. So that's the most important thing, that we have the information about how sick someone is. If you have mild COVID, Dr. Heggie at times has described it as well COVID, pushing that person out of a remote community, out of Imampa, into Alice, takes up a bed at the Todd facility or the Alice Springs Hospital that should be used by someone who is, say, homeless in Alice Springs, but positive and needs a place to isolate, or has acute need. So for me, it's more about getting that right. That's the overall approach. In particular individual communities, differences might need to be taken in the approach. I can follow up on the Imampa one specifically about what might be happening there. But as far as I'm aware, my confidence is in every remote community, if someone has severe COVID or more than mild COVID, we are aware of that and getting them into the care that they need. And that's my main concern. Symptomatic and vulnerable people have absolute access to their care. We now have the lived experience in the Northern Territory, the interstate advice and the international example that the majority of people with Omicron, while it will suck, can be treated with Panadol essentially at home.
And in a situation such as Palumpa, then, for example, we've heard of people who need to isolate because they're asymptomatic of a mild illness. They're not looking necessarily for more care, but they don't want to stay in the overcrowded homes because they don't want to give it to elders or local TOs. There's a situation there where 30 people are isolating on 10 mattresses in a local council facility. What is the best approach there? Do they stay in their home? Is that what you're saying? Do they stay in this overcrowded facility if there's nowhere for them to go?
I think there's two things that's happened there, and I'll follow up with a case I'm mixing up two different examples. I understand there was a temporary situation in Palumpa until the runway was cleared, so you couldn't land a plane, so there was a temporary setup that became more used than was expected until the actual runway could be used. And then separately, and Dr. Heggie just touched upon this, I'll pass back to Dr. Heggie. If you're positive with COVID in your household, it's likely that other people in your household already have COVID or are about to get it. So isolating away from them is probably an unnecessary measure to reduce the spread. In fact, you're more likely to take it away from you than to somewhere else. You probably do want to keep that person at home, and the number of people in the house is probably not important in the sense of the fact that everyone in that house is probably already likely to have had it or about to have it. So I'll pass to Dr. Heggie to confirm that. So we're trying to prevent the spread out of that house. If you start taking people out of the house, you take the COVID with you.
Thanks, Chief, and thanks for the question. So the first thing is, in terms of response to small communities, there are a lot of small communities and also homelands and outstations, and where you don't have a health presence, there's an in-reach service available. I think also covering up what was asked about people quarantining in an alternate place, I think that's entirely a safe approach. We're talking about 7 days and of a group of people who are quarantined together. I think we partner with local communities to look at what their solution is. So in some cases in Central Australia at the moment it might be a sorry camp because the weather is not wet. So it's local solutions for where people can safely quarantine, but most importantly, it's actually the identification of people who are potentially going to get unwell or who become unwell. And we have a long-standing system that I've participated in and led it, and that's a telephone roster for all remote communities around the Territory, where you get telephone advice either directly from the patient or the family or from the health centre as to what might be required in terms of a response.
Just one more way there, Dr. If this is the peak of cases, potentially like this week, what level of hospitalisations are you planning for over the next 2 weeks?
Well, if it's proportionate, it's still going to be a small number in terms of comparators with other jurisdictions, right? So the numbers, it's about ICU capability. That's not just the beds that we actually have, but also the areas, and I think I've referenced this before, about where you can convert the recovery area or the pre-op area in a theatre for that purpose, and with staff and ventilators that can assist. We haven't reached that level at all. So I think what we each day monitoring those numbers, and they've remained remarkably stable. In terms of bed capacity, yes, we've got a limited number of beds, but at the moment actually decanting people who don't need to be in hospital, who can be at home and managed as hospital in the home patients with support, that's entirely appropriate.
Chief Minister, I just want to get clarification on an issue that's been raised about the booster mandate. We've got a couple of disability service providers who are saying the mandate comes into force on March 11th. They have staff that at that point still won't be eligible for their booster for their third dose, and they're worried that they may have to stand down those staff. Do they have to have their third dose by March 11th if it hasn't been 3 months?
No, it's 4 weeks after the date they're eligible. That's in the direction as well. So March 11th is the most convenient date to put. That's based off the people who applied with the original direction. But we recognise that there was people who may have been employed post that direction, so then it's 4 weeks after they are eligible for the shot. There's also a caveat that I'll pass it to Heggie in case I've got the weeks wrong here. You shouldn't get your booster 6 weeks after you've had COVID, and that's also covered in the direction too. So there's 4 to 6 weeks was the range. Obviously, for a direction you have to be specific, so you aren't required to get your booster shot until 6 weeks after you've had COVID.
End of the first week of the school year, how many teachers have tested positive?
So the advice I had, and this may have changed since the last I had it, was around 100 teachers, and that was being covered not perfectly by the pool, because obviously it depends on sometimes on the and you start to plan for this, the right teacher going into the right classroom, the right year level. So sometimes it's managed within the school environment, sometimes it's managed out of the relief pool. The relief pool was 100 plus, and around 100 teachers were positive last advice I had.
Are you hoping that that's sort of the extent of the spread? It was an initial outbreak, or are you expecting it to just spread within schools and there'll be a rolling issue this term? Or?
If it remains proportionate to our cases, and I don't have a reason to believe that it won't at this stage, but there is a chance it should remain proportionate to our cases, in which case the advice from Dr. Heggie and other chief health officers is that this is around peak and then declining. So this should be about where we are, but we'll obviously have to see where we go now. That's the advice we're receiving.
A lot of businesses were saying back in mid-December that they were starting to see the Omicron wave really starting to hit their bottom line. It's taken now until February for you to unveil a sort of relief package. Is this too little too late?
So this is based off their December and January taking. So hardship register obviously requires them to show a 40% reduction in their takings for January this year compared to January 2020. So not last year, that's 2 years ago, so pre-COVID. So we said we recognise December, we recognise January, and this allows you to then apply. So we had to, unfortunately, get through January for people to be able to be eligible. We think this is kind of the right areas. Puts a little bit of cash in the pocket, takes 30% off the utilities bills, power, water, and provides that payroll relief as well. So that's a reduction in cost as well as some cash in the pocket. But it recognises December, January, very similar to what New South Wales has done At 40%, it's more generous than we did this 2 years ago in terms of the filter in, and it puts us on par with New South Wales. I think SA and a few others are still at the 50% mark. We've dropped ours down to a 40% reduction in taking. So I think this is kind of the right areas. It won't be a perfect package, but it's kind of the right areas.
And the Treasurer was in town earlier this week, and I imagine that you had a one-on-one chat with him. Did you raise the prospect of the federal government coming in and providing some further assistance to businesses?
I always take an opportunity when I meet with the Treasurer, and he's always prepared for it, obviously. But everyone takes the same opportunity to meet with the Treasurer to talk cash and talk money. I won't go into the details of the conversation. Obviously, I have a lot of respect for Josh, but we talk about the territory fiscally and economically, and the kind of help we would like. They obviously have a position as an Australian government nationally, but I always take every opportunity I have with Josh, to hit him up for cash.
Businesses were calling for the reintroduction of this package and the Small Business Survival Fund. Why wasn't that also reintroduced?
So, Small Business Survival Fund and Hardship Register, one was relief. Hardship Register was relief from power bills. Small Business Survival Fund was cash in the pocket. This is both. So there's cash in this one. So it's not the same levels as the previous Survival Fund. Back then they couldn't open their doors at all. Obviously now they can open their doors. It's just reduced customers in. So this is basically a combination of both those packages.
And you were speaking at the start about the confidence you have that there'll be a very strong dry season ahead. Given Omicron kind of came out of nowhere and everyone's saying there's more variants to come, how can you have that confidence?
I believe we're a very prepared and resilient jurisdiction. I think that we have got a highly vaccinated population and we will have a highly boosted population. I believe people are now understanding the virus. And if you look at what we're currently going through, unfortunately part of this has to be a lived experience. The reason why I believe a number of people aren't going out now is fear of catching COVID. We have 7,000 people with active cases, of which 150 need hospital attention at the moment. Those 7,000 people who previously had COVID, by and large, are now realising that while it sucks, it can be treated at home. So a lot of the fear factor, I think, out dealing with COVID is going away. If we are dealing with another variant or et cetera in the future, I believe people will be more willing and understanding of the minor measures you might need to bring in to address that, more understanding of how to live and manage, personal responsibility of living and managing with the virus, and therefore I don't think we'll see that same reaction right now. We've got people essentially locking themselves down, I believe, out of abundance of caution to make sure they don't catch COVID. I believe we'll get past this. Omicron normally has around an 8-week curve. Depending on how you look at it, we're week 5, maybe even week 6, probably more week 5 of that 8-week curve. We'll get out the other side. There'll be a long tail. That 8 weeks is based off other people's experiences, other jurisdictions' experiences. There'll be a long tail, and then I think we'll be very ready, able, capable, and willing to deal with any future variants if they pop up.
Could I just clarify what you said about the booster and people with COVID? On Wednesday, Dr. Payne said it was 3 months post-recovery until you can get your booster.
Oh, okay. I saw 6 weeks, but I passed Dr. Heggie.
So there's two answers. You can, if you need to, have it 6 weeks after. And that's important for people who are more vulnerable or who have an essential worker status. On the other hand, it's like when you have your first vaccine, it's better to delay up to a point to have a second one and the booster as well. Because if you have it too early, your antibody production isn't actually up and it needs then boosting beyond that. So both answers are correct.
So if you're having 1,000 people a day get COVID and they're not eligible for their booster between 6 weeks and 3 months, how does, once the mandate for the booster is in effect,
yes,
how do they go about proving that they've had COVID and the mandate doesn't affect them until they're once eligible?
So it is certainly possible to get a medical certificate from a health practitioner to show that you did have the infection, because that will be evidenced by a test that you had. I think also we have a process, and I do participate in writing exemptions for people that were not able to get it for whatever reason. Whether it's because they been on leave away and couldn't get it. So no, I think that we don't want to impede people, but we want to encourage people to have the boosters, particularly because that's the evidence, particularly with Omicron, and particularly if you have an mRNA vaccine as a booster, that is even better again, and that's what we're using. There does seem to be around the country some reluctance for people to step forward, and it's not clear what the reason for that is, because people have been eligible but not stepped forward to have it. But that is the thing that actually does really protect, gives you the greatest protection against serious illness, harm and potentially death.
But is it going to a GP, getting a medical certificate, writing to you, getting exemptions, not clogging up an already clogged up health system?
Well, this is a small number of people. Okay,
it's 1,000 a day though.
Oh, you mean but if you're talking about the number of people that need to have the vaccine, the booster rather, that's a mandated dose, that's actually a smaller number, obviously, than the total number of cases that we're seeing.
Yeah, so it's my understanding that both of the deaths that were reported in the last week were never hospitalised, and feel free to prove me wrong on that. So how can we take ICU and the number of people on oxygen as a true indicator of what's happening in communities and with the severity of the virus?
Well, the first thing is the facts, and that there have been some people who have actually been in hospital, not in ICU, but actually did then succumb, and that's often because of their age or their comorbidities. The definition of a COVID-related death is based on the death certificate that is written, and we have a process in terms of directors of medical services to scrutinise those, and they need to align with the national definition that CDNA have used, and that does require some time. So I think that it's to be recognised that sometimes people actually will actually lose their life to COVID before getting to hospital. That's true. And in some cases, people may not choose to participate in active care, and that's their right as well, particularly for Aboriginal people who are living on their country and want to pass away on their country.
Last couple, please, guys.
Just on another issue, do you agree with the new Icac Commissioner that people have lost trust in Icac and aren't reporting corruption?
I think the new Icac Commissioner has reflected some of the public debate that has occurred since the moving on of the first Commissioner and the starting of the second Commissioner. I believe the Icac is an independent body. I have confidence in it, and the new Icac Commissioner will do his job. I've got one point of difference with the new Icac Commissioner. I think we disagree on the definition of short. Yesterday he said he attached a short video of 45 minutes for people to watch, which I'm not quite sure 45 minutes is a short video.
Short press conference.
No, thank you all.
Everyone, thanks.